Hi, Dr. Sherman Silber. And then she has some terms here that I am not familiar with. So
Are you familiar with cerclage? And cerclage be done before tocolytics and antibiotics. So let me explain what she's talking about. And I think Roz could pipe in on this also. So if someone has a premature contractions, so there's a risk of premature labor, there are tocolytic drugs that can suppress those reactions. But if she has a incompetent cervix, then there's no choice but to do a stitch around the cervix and close it tight. But you don't want to do that once she started in labor. Once she started in labor, that's not, well, you could do it, but it's not going to work. So if you suspect a incompetent cervix, like from a previous LEAP procedure, for example, if you expect an incompetent cervix, then by 14 weeks you should do the cerclage before there's any risk of premature labor. Uh, but Roz, what tell you know
Yeah.
I'm not an OB. Tell me what your experience was.
Of course, I didn't. Every part of our journey has been a miracle. So I went in. I was just writing this down actually because it's been such a whirlwind. I went into labor on the day that I turned 28 weeks,
Ooh.
and it was back labor, and I was like, well, they talk about, there's studies that like women aren't listened to in healthcare. Like I wasn't listening to myself. I was like, it's sciatica, it's Braxton Hicks. But yeah, we got to triage in Chicago, and they were like, we're gonna try and stop your labor. But my son was just determined to come on out. But they were able to give a steroid shot to bolster the baby's lungs, and yeah, they were in there. She was in there, which is pretty standard for 28-week preemies to stay in until their due date. She actually got out about 10 days before her due date.
She was almost 2 weeks
Yeah.
prior.
So how many weeks did she deliver at? When?
So I delivered at 28 weeks on the dot.
Wow. So
Yeah.
that's really modern prenatal care and fantastic, really.
Every part of our story, like, is like the fact that these are, we don't know which eggs they came from, if it was 30 or 35, but that these babies are possibly from already 10 years old, and that they were over 2 pounds. We made it to 28 weeks, and they just had to grow a little bigger and stronger at the NICU in Chicago.
Well, let me ask you, you started having contractions at 20 weeks. Were they able to hold that off till 28 weeks?
No, I didn't have contractions at 20. I started having contractions, and I delivered at 28.
Oh, so it started at 28, and that was it. They couldn't really stop it then.
Yeah.
They tried to slow it down, but it didn't work.
Yeah.
Bo, I was kind of out of it, so Bo could probably talk about it better.
We got about 6 extra hours out of the drugs.
It's really amazing. So these 1.5 and 2 pound babies in the NICU, they develop and they grow up to be super intelligent, fantastic kids. There's, no negative impact from it. It's
well, I think they come out and they have to push a little harder than other kids. And the only thing is, our son's in the NICU right now, and you have to pass a bunch of milestones. You have to breathe on your own, eat on your own. And it's not that he doesn't know how to eat. He definitely can. He's just like, can't be bothered right now.
Well, I'm sure he will be, and he'll be just fine. That's really exciting. But in terms of the question that was asked, the tocolytic agents really didn't work for you, but luckily you were at 28 weeks. We try to get them to 32 weeks, but at 28 weeks, that's fantastic. And what didn't apply to you is there are some women that have an incompetent cervix, and we know about it ahead of time, and they should have a cerclage done at 14 weeks, and that'll really protect the cervix from opening up and losing the baby that way. Because then if at 20 weeks the cervix opens up, it's too late to do a cerclage. But that doesn't apply to you. You didn't have that.
I did have fibroids, though, if anybody. We did take care of that before the first transfer.
Yeah. How? No, wait a second. I don't remember that. We did the fibroid before the transfer?
Before the first transfer, but I saw your partner.
Dr. DeRosa.
Yeah.
Yeah, okay. And he did the fibroid. Okay. Yeah, it's good to get rid of those fibroids before the transfer. That's
yeah.
Really,
so that was another blessing to take care of.
That's another reason we don't want to freeze the embryos for IVF, because very often we have to take care of a polyp or a fibroid or multiple fibroids, or maybe the lining isn't that great. So as long as you have that embryo frozen in a way that is safe and reliable, so I mean, we don't do any damage when we freeze the embryos now with vitrification. I mean, there's zero damage. So that way you can make sure the uterus is most receptive.
Mhm.
Well, okay. So I only have a couple of more minutes because I have to run to a meeting. Uh, Roz, do you have any questions?
I don't. I'm just, I guess if anybody's questioning whether or not to go forward and do this, I would obviously my whole life is wrapped up in this. I probably would have, you know, maybe been with a man that was not my partner, was not as wonderful as this guy here, because I thought, that was my last chance to have kids. We wouldn't have these beautiful children, and I wouldn't have been able to work on my career. And it's just,
You were comfortably able to wait for the right guy.
exactly.
And then when you didn't get pregnant naturally, the right guy, you really didn't have to worry about it because you had these young eggs all ready to go.
There was always hope. There was always, and there was never really any despair, I think. And we were able to get to know each other at a normal pace and, date and not, rush ourselves. And by the time we had these children, we very much wanted them. We were ready for them. And, pretty cute.
And for my 2 cents, the amount of effort that we did to get them here helped carry us through. 100 days in the NICU is tough to do.
Yeah.
But that silver lining always kept us in good spirits, and it's amazing how what you guys do on the medical side of things to get these guys here and healthy and happy, and it's what we always wanted.